Tonight.
I thought I had a bad cold and just had trouble breathing. I went to bed. 3 days later, I woke up in the hospital with a tube down my throat.
An ABC 27 special presentation.
He didn't know how bad he was. He didn't know how we almost lost him.
Penn State Hershey Heart and Vascular Institute presents Heart to Heart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. February is American Heart Month, and tonight, specialists from Penn State Hershey Heart and Vascular Institute are in the ABC 27 call center to answer your questions. Call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Nurse practitioner Mary Lou Osavala will answer your emails throughout tonight's calls, and keep in mind, always, your calls and emails are always confidential. And we begin tonight with Deborah Pinkerton to share one patient's story with you. Deborah?
Thanks, Chuck. A Cumberland County man thought he had a cold, a bad cold, but he was wrong, very wrong.
There's no better feeling than to be out, feeling the wind blowing over you and just being out in the open air. It's just something you can't really describe. You got to experience.
35-year-old Jason Wetzel is experiencing it now. It's always been a dream of his to own a motorcycle.
It's something that I wanted for a long time to just experience, and I finally can now.
Jason's dream was put on hold for many years until this past summer.
After everything that happened, I decided, this was the year. It's something I wanted, and not many people get a second chance at their dreams to do and fulfill. So I went ahead and took the plunge and did it.
Jason knows how quickly dreams can be snatched away. His dream was almost lost 14 months ago.
I just was having some chest discomfort and was getting short of breath and just really felt like a chest cold is really what it felt like.
About 2 weeks before Christmas, he went to the doctor and they gave him an antibiotic and some congestion in his chest, but no big deal.
He gave me some antibiotics and he gave me an inhaler and said, when you get out of breath, use the inhaler. So I did that for a couple weeks.
But Jason's condition did not improve. A few days after Christmas, he was still sick.
I was not feeling well. I fell asleep downstairs on the chair. My wife, she woke me up. She said, Jason, she says, you're already asleep. She says, why don't you get up and go to bed? Well, I got to the top of the stairs and I was really out of breath. Really didn't think nothing of it.
He had been snoring very, very, very bad. And he's always been a snorer, but nothing to the point where I've had to leave my bed. And 2 nights I had been sleeping on the couch, 2 nights before. And I believe it was the Lord. I didn't sleep on the couch that night.
It's a good thing, because around 3:15 in the morning, Jason's snoring woke up Melanie.
I noticed it was not snoring, and I thought it was actually him having a bad dream. And I proceeded to try to wake him up. Come on, dear, you're having a bad dream. Wake up. And he obviously did not wake up. He was making very gurgle-ish type noises, and I screamed. Both my kids came over, and my mother-in-law at the time was living with us, and she even came upstairs because I was so distraught. And I immediately was really just shaking him very hard, and I knew something was wrong. And I got 911 on the phone. She's like, you need to stay with me. Is he breathing? And at that point, he was, but it wasn't too long when he stopped breathing. And my kids were just screaming and just saying, this isn't happening to us. I had taken CPR and first aid years and years ago, and now all of a sudden I had to use it again. No, actually for the first time on a real body, and it was my husband's.
Jason's life was in her hands. The 911 operator talked Melanie through CPR.
Praise the Lord, I had my mother-in-law with me. Her son. She and I were a team. She did the breaths, I did the compressions. In moments, I had these just totally controlled men and women coming through my door totally taking over for me.
They found him ventricular fibrillation, which is in a very abnormal rhythm that causes cardiac arrest.
They revived him enough, I guess, at that point to be able to transport him to the hospital.
Well, she basically saved his life by being able to provide CPR until the ambulance came home.
Jason's situation as he came here to Hershey Medical Center was very poor. He came in advanced cardiogenic shock. That means his heart was not able to pump enough blood in his vessels and to restore his circulation.
I felt like a total, a shadow over me, like this is not really happening. This is not happening to me.
Our suggested treatment was to put him on ECMO. That's extracorporeal membrane oxygenation. We are taking blood from the right side of the heart, pushing this blood through an artificial lung, through a pump, and from this pump the blood is going to be recirculated to the aorta, and that means we are replacing the function of the heart and lung.
I knew nothing about this ECMO machine. This is how they described it to us. We're going to give his heart a rest. It needs to rest.
RNs like Carol DeZina are responsible for patients like Jason.
There's a nurse at the bedside 24/7, and you're responsible for monitoring the vital signs, any changes that occur in the ECMO, any changes that occur just in the patient that you visually see, along with monitoring lab values and so forth. Generally, the patient at this point is so sick that we usually have them sedated, so they're not aware of what is going on.
As you can imagine, it was a very difficult time for the entire family. Decisions were being made on how to save Jason's life. You will see the rest of his story in a few minutes. Chuck?
Thank you, Deborah. Now joining us on the desk is Dr. Christoph Brem. Doctor, we watched that whole development, how it came about, what they treated and so on. What caused these problems with Jason's heart?
So in Jason it was a dilative cardiomyopathy, and in the acute situation he probably had an additional viral infection, and that basically tipped his situation over the edge and he got decompensated.
And he responded quickly. Now, here's a very common question. Lay people, such as myself, get this wrong all the time. Explain the difference between cardiac arrest and a heart attack.
So in a cardiac arrest, your heart basically stops pumping blood. That means your complete circulation is stopped. And in a heart attack, the blood flow to your cardiac, to your heart muscle is impaired, which is different. But if it's severe, it can lead into a heart arrest.
All right, now, we always hear chest pains. That's a logical, very open, very common symptom for a heart attack. Talk about some other signs that people maybe don't think of as being a bellwether.
So while chest pain might be the leading symptom, you can have pain that's going into your arm, going into your back, even going into your jaw, your teeth could be possible, or severe abdominal pain. All those could be signs and symptoms of a heart attack.
Now, we saw in that report that the procedure they call ECMO, I'm only quoting what they say because I can't say the official name. Now, that was used in his case. Talk about some other situations where you might employ that procedure.
So normally we are using ECMO, or ECMO is commonly used in two situations. One is the heart failure situation like Jason was in, and the other one is in severe respiratory failure. We also call that ARDS.
Now in respiratory failure, how do you employ it in that procedure? How does that
So
work?
in respiratory failure it's working like we are draining the patient's blood out of the patient's body with a pump, and it gets put through an oxygenator and gets oxygenated, and then we can rest the patient lungs and give them a chance to heal while the machine is doing the work.
So you actually take the blood out?
They
do the
actually
work?
take the blood out with a pump that's going to an oxygenator, it's oxygenated, then it's going back into the patient, then we can reduce the setups on the ventilator so the lungs have a chance to heal.
Now this ECMO procedure, is this pretty common? Is it available in a lot of hospitals?
It's not available in a lot of hospitals because you need a lot of stuff and you need a lot of specialists to do that. So if patients are in other hospitals are pretty sick and they need ECMO support, we have the ability to go out with a team to go there to see the patient in the other hospital, to put him on ECMO there, transfer him back to Penn State Hershey for further medical management.
Amazing development over the years how this comes about. Thank you, doctor, for joining us here tonight. At this point, we're going to check back in with Deborah and the ABC 27 call center.
Thanks, Chuck. We are getting a lot of calls here, and they're ranging from all different calls, from pediatric calls to adult calls regarding heart disease. Once again, you can call 346-3333 or email your questions to questions@abc27.com. Now, here to answer our first viewer question is interventional cardiologist Dr. Mark Kozak. Thanks for being with us.
It's my pleasure.
This is the first question. My son was born with congenital heart disease, specifically coarctation of the aorta. If we were to have more children, what is the risk they will have the same disease?
Well, if one child is born with congenital heart disease, the estimate is that each subsequent child will have a 3 to 5% chance of having congenital heart disease. But it is not guaranteed that it will be the same type of congenital heart disease. So the number 3 to 5% sounds large, but overall 1% of all children born will have some type of congenital heart disease. So it's a slightly increased risk.
Okay, thanks so much. And we will have more viewer questions coming up. Plus, we'll have the rest of Jason's story.